How are you?
I'm fine, thank you. You?
Good. How's your therapy going?
It's going okay. I was wondering, so should one kind of select a subject, or does the person need to be guided by a therapist with?
We mean before the session.
Yeah, before the session or during the session, yeah.
Well, I guess you can always, when you're at home, you can think about something that you really would like to talk about and you can bring it in. But it doesn't mean that you have to be stuck with it.
Mm-hmm.
So, because whilst talking about this, you can start thinking about other thing or remembering something. So you should just go along with it, and your therapist should facilitate you kind of remembering and talking about what you want to talk about and making sense of it. Yeah.
And what if there is some sort of event that happened? Do I need to bring it in, or is it about just keeping on the course of the discussion of what is like the set topic?
No, I wouldn't say there is a written course of discussion. You can, some therapists do prefer to do session contracts, kind of agree what I would need to do during the session, but it doesn't mean that you can't recontract again and say, no, this thing came up and it's really important, I want to talk about that. And so that's fine, yeah.
Okay. Another thing is like, well, how does one know whether it's working or not? Like, is there any sign?
Therapy, I mean.
Yes,
Yeah.
yes.
Well, you should just notice yourself behaving slightly differently. Well, first, like thinking differently, then feeling differently, like things that used to upset you might stop upsetting you, like some boss that you hated, you might not find him that much and just find ways around kind of how to work with him. And then slowly you would also start behaving differently, maybe choose different friends, or maybe you would decide to change your job or a partner. Kind of slowly you would notice signs, yeah.
And like, when should one stop the therapy, or is it something that? How does one know whether it's time to stop it, or there are ways to, like, I don't know, not stop it but pause it, or what is the way to kind of?
Well, it's complicated because you can. I have clients who have been with me for like 3 years, and then they maybe pop back for once a month just to check up and how they're doing. But sometimes you feel that you have done what you could do with this particular therapist, and you have sorted things in your life you wanted to be sorted. And then maybe it's time to pause or to stop, with an agreement that you can always come back if you feel like, if you like this particular therapist. That you don't have anything more pressing in your life that you really need to get sorted. Yeah. And
is there like sometimes that people end up like depending on that, like in a sense, like, oh my god, what if I'm gonna let this go now, like I'm just gonna collapse, like, or something will immediately happen because I stop seeing.
Yeah. Well, there are people like that, but therapists shouldn't encourage it because therapists should facilitate the client, not just depend on therapy. In therapy you learn how to behave differently, but also to make sure the client has wider support network, like family or friends who are understanding and are happy to accept client, how client has changed, etc.
So is there a case that sometimes family and environment does not accept people changing and kind of want them to stay the same?
Yeah, that might be a problem, yeah, but then the client has a task of, finding new friends and different environment. It can be quite tough, yeah.
Oh god. So it's almost like a vicious circle, right?
Yeah, because if you'll get stuck in the same environment, you'll go back to your former pattern.
So it's I guess it's sometimes hard to come out of it, right? It's hard
to
like actually recover.
Yeah.
Oh god. Oh, this is quite a lot of thinking right now.
There are lots of things outside therapy, just to think about. Absolutely. Okay, well, if you have any questions regarding stopping therapy or how to bring therapy outside therapy, let us know.